All right. So good evening. It's 6:10 p.m. on Wednesday, February 21st, and I'll call this special meeting of the Board of Education to order. This is a budget work session. The first item, the superintendent has provided us with additional efficiency reduction opportunities for discussion. So if you'd like to start.
I don't know if you want to go on and put up your document. We're going to start kind of from the beginning where we started before with the non-personnel efficiencies, reductions, opportunities, just to kind of go through those quickly. And then we have been given the go-ahead for the OPEB payment of 1.6 to hold off for, payment. So that can be reduced from the budget.
Maybe we could just ask what's being seen by people online. Because David shared his screen.
Oh,
They're looking at me.
Mark, can you see the screen if there is the document showing? Because we've tried to share it.
Yes, I can see it.
Because we cannot see it in here. I don't know if Clint can take a look at why we can't see it, but. Oh, there we go. Thank you. And I think it could be a little larger too for some eyes.
That has to be done on your end, enlarging it.
All right, we can do that. That magnifying glass when you need it.
Mark, can you check on the YouTube live feed too? I'm hearing that that's not up yet.
Yes, I'm working on that with Clint.
Great, thank you.
Okay, Dave, we'll just kind of review what we've done here on the first page.
Yep,
Which is the
so-
beginning steps.
It's really the first two, but anything you see in green, we've made those adjustments. I've highlighted the one item, which was the site budget. If you recall the last time, our last meeting, excuse me, when we mentioned bringing the site budgets equal to last year, that did include the ROTC funding of 50,000. So I highlighted that in yellow because I did not take that out. I just retained that. So I just wanted to make sure you're aware of that. So with these adjustments, I'm just going to scroll the second page real quick. Go towards the bottom here, with the adjustments, the first line that says proposed budget brings us to 9.22% increase, or about 7.5 million.
Can't seem to get the YouTube up and running.
We have a second page. Page 3 is going to go into some more details. I just sort of laid it out here for you with about $375,000 of additional adjustments, which would bring us to the green number of 8.76%. If you don't mind flipping to page 3, we'll just get right into some of the details here. Excuse me. So the first item is actually an investment of $180,000 for HVAC testing.
Which is required now by law. It's one of those, another unfunded mandate that's required. And I think by 2025 or 2026, I think we have kind of a 2-year spread to do that. Okay. But there's a potential waiver to extend it to 2026.
Yeah, there are two, excuse me, there are two parts to this. The first part is the indoor air quality, which is the Tools for Schools program that we will reinstitute, which requires checklists filled out by both maintenance and the school building, so they're healthy. School teams will do those checklists along with the custodians and maintenance departments. That's one part of it. And so we'll have some learning to do with that and some training to do with the Tools for Schools program. And the second part is the HVAC testing, which means that you have to actually test the HVAC systems and then make any pertinent adjustments to those in a timely fashion. So we have an estimate of roughly, we will have 6 schools to do, or 6 buildings to do. Fitch High School, Charles Barnum, Northeast Academy, Catherine Kolnaski, Mary Morrison, and here at the CO. However, because Groton Middle School did a commissioning in 21, and Thames River and Mystic River did a commissioning in 2022, those meet the 5-year limit to the testing. So at any rate, we'll have to do the HVAC testing every 5 years from the time that we do it. So the estimate that we have is it averages in the $30,000 range per school to do this testing and the balancing of the systems. So that's what the $180,000 is for those 6 schools.
And that would include central office, which is the Transition Academy
Uh-huh.
and an Apex Academy. So it is considered a school. And then Mary Morrison, which does our ECAT program, which is our early childhood assessment team. And we do have students who are in there for speech and language. So that would also have to be kept up with,
That's correct.
in addition to CB, Fitch High School, Northeast Academy, and Catherine Kolnowski.
That's correct.
Okay.
I'm getting a notice that we're still not live. And did we lose Beverly?
We are live now.
Okay, good. Thank you.
Bev shows up. She's being there, but she's got her mic and camera off.
Okay, all right. I just can't see her on my screen.
He's got it live. He's showing you. Clint. Yep.
So the next 6 are some additional proposed people adjustments. These are all in ARP today, so they would not carry forward into the board next year. The first one is a 0.5 magnet specialist. Maybe I'll just go through these first. The second is a part-time custodian. The third is really reducing the community coordinator hours. So we're not going to eliminate the coordinator jobs. It's just reducing their hours.
And those were only increased during COVID in our BESSER. So that is why we're reducing them back again.
The other is security guard. And then 7 math tutors and 3 SEL tutors. So with that, the net of that is savings again of 375,400.
Adrian?
Yeah, so like it says, eliminate the tutors, security guard, all these eliminations. Is this the same when I go look at the positions not carried forward?
No, these are
Or
additional ones.
these are additional, it looks like there's 65 position reductions from before. So this would make it more.
These are additional on top of that.
And I think you found, Lori, you found some tutor hours from prior to COVID. Do you have those?
Oh,
that you-
I think the question was of FTEs of paras and tutors pre-COVID. I think that was the question. I did check today. Oh, I'm sorry, my microphone's not on. I did check the para tutor FTE counts pre-COVID, and in 18-19 and 19-20 school year, paras were in the range of 192 to 195. And tutors were in the range of fluctuated year over year, but between 16 and 18 tutors. Mainly ELL, a little bit of literacy.
And then we were able to, not so much with the paras, but with the tutors, we were able to increase them during those ESSER and ARP-ESSER days.
Correct. All of those additional tutors came from the ARP-ESSER fund.
Do we have a number on what that was during those times, or
It's about another
total?
75, I'd say.
of the tutors?
75 tutors, yeah.
And
approximately.
so do we know now currently where we stand if we reduce all of these?
Yeah, we'd be
Yeah.
at 36.
Yeah.
So we didn't bring them all the way back to pre-COVID.
Correct.
We do have a high dosage math tutor grant that is going to take us, I think, two next year. And then I know that we have some of them in Title I grants as well.
Yeah, the 36 would be the ones sitting in the board.
Okay.
Yeah.
So that's just the board. So we have additional ones that are outside. the board.
Absolutely. Yep.
And I know the high dosage tutoring, there's a possibility of it getting that extended another year.
Good. That's wonderful.
That would-
glad.
That would be great.
Yeah, that was really good news, Phil.
Another question, Jason?
So.
Yeah.
Go ahead. Question about the tutor's caseload. One of the questions I asked. Get a sense of the caseload of the tutors that, you know.
Well, that would vary by school, so we'd have to get that from the principals. You know, which school, I mean, they usually take small groups and they take them throughout the day. So that would mean that in their SRBI process, they would have to figure out another way to support the kids who didn't get those services.
So is that data that's possible to get at some point?
I can certainly reach out. Phil can reach out to the elementary. I'll reach out to the secondary and we can divide and conquer.
Can we just make sure the mics are on?
I'm sorry.
Mic issue, not hearing people clearly.
Hello?
I can hear it in this room, so I'm not sure. Beverly, can you hear us all right, or Joan?
Yeah, I can hear you all right, Mark.
Okay,
I can hear you also.
all right, thank you.
So. A question about the IT and the finance temp help. You know, we talked last meeting about, the software of the budget. And maybe do something that is more accessible and easily shared.
Sure.
And you mentioned that the IT was having.
Ian, can you speak in the mic, Ian? I can hardly hear you.
I wonder if it's his mic.
I wonder if
You
it's
want
your
to try
mic.
the other one, Ian? Sorry.
That's what I was indicating, but everyone said they could hear. The mic is not
Okay.
clear.
Can you hear me now?
Yes.
Thank you.
Must be that mic.
All right. So,
Yeah, that was it was,
the IT temp help and the finance temp help, which one is that, or are they both?
it was the finance temp help that I put in. I can't remember the number of hours, Ian, but it was potentially hours to help with getting the new system up and then transferring the data into a new budgeting system.
All right, so,
So I took it out right now. That was part of our initial.
that was the
initial-
finance temp help?
That was the finance. It was like
Okay.
5,000 or so,
Yeah.
5,300. Yeah.
And the tech temp help happens in the summertime. We usually have some of our college students returning and they help with the summer work that happens here. And Clint took that off too and said he'll use his own staff and, you know, we won't have the extra help.
Okay, so as far as the software itself, is that still included in the budget?
It's a new software is not, it's never been in the budget. No, I've never had an estimate.
Do we have
for
a
it in the
price
budget.
on that?
I don't have a price. I'm not sure what the estimate, to be honest with you. You know, I think we'd have to put a placeholder in.
To be honest, I mean, that was something that I think we should invest in so that we can have, you know, better access to the
We
budget
all
moving
agree.
forward.
He
Yeah,
needs
no, I
something
agree.
much better than what he has. I agree with you. I
So,
asked the same question. but
Totally
think
agree.
we
I
need to
was just
find-
hoping to get a firm number, but I just don't have one right now. So we'd have to just make a call and put some sort of estimate in.
all right, is that something we can get done by the end of the week?
Oh, yeah, I
Or,
mean, I can give you some recommendations, you know, I can I'll do some research online and just try to get some ranges on what some of these cost,
right,
for sure. Yeah, want to put them on FAQ? Is that easier?
sure.
Okay.
Yeah, that'd be fine.
Yep.
And aside from part-time clerical and full-time clerical, See, I see a reduction of 2 school admin assistants. Is that central office?
We had some in central office and we had them in the schools, I think. both.
Should be should be right above those.
All right, because I'm looking at the central office sheet right now. That was, I had to dig this out of the spreadsheet. But I'm seeing there's like 1 director of special education, 3 special education supervisors, a student data manager, and a student data specialist. What's the difference between the data manager and the data specialist?
One is a power school person who oversees all of power schools, and that is a full-time job in and of itself. The other one is really a data manager, so she is actually overseeing all the data that gets collected for grants and for being an alliance district and, you know, the many projects, presentations, state reporting. So she is constantly busy. And she goes into the district data team and she also goes to the school data teams, helps them interpret data. So, and helps us with really the SRBI or the MTSS, multi-tiered systems of support that we offer our children. But it helps teachers interpret the data as well.
Yeah, works with the building principals.
Right. So there are 2 very different jobs. I know that the names sound very similar, but they're 2 very different jobs.
And we have 2 transportation coordinators.
We do. One comes in early in the morning. They overlap kind of middle of the day, and then one stays late at night because I really need someone in this office. STA, the bus drivers and STA, you know, are contracted by us, but they're not part of the Groton Public Schools team. So we need someone here. When phone calls come in, you know, curtain vans, they really have to be here 24/7. If buses are running late, we have a system where we're doing parent square messaging to families so they know ahead of time when a bus is delayed. So it's really imperative that we have someone answering that phone and listening to our parents because they get very nervous if something doesn't go right with the bus or drop off or pickup. And then I've got Sam who really backs up some of those phone calls too when people have concerns.
So in the past, Andrea mentioned a few weeks ago when we had that meeting that we discussed the tutor situation. And you mentioned that at one point in the history of the district that the administrators chose to take a wage freeze in order to allow for more money to be available in other parts of the budget.
We did.
What was the process involved with that?
It was under Dr. Riley, so it was a long time. I think they just came to the, they just came to the union and we took a vote, as I recall.
The union took a vote to, or was it non-union positions?
No, I'm pretty sure that we took a vote. Do you remember?
It'll be contract then.
Yeah.
Hmm.
I know, because we got a lot of compliments on that. And I'm not suggesting that anybody do that. I'm just saying that we did it.
Mm-hmm. Well, that's one scenario I think maybe we should look at as a board.
I'm sure all the principals.
Well, I think that would be really harmful to the culture and climate in this district because they've been fairly negotiated, and to ask people to cut their wages would not be fair, especially to the administration who was working 24/7 on the weekend, and they're managing our buildings and they're in charge of teaching and learning. So I would not recommend that at all.
Well, I can tell you, not one of us was happy.
Yeah.
We did it, but we weren't happy.
Right. I don't think there's a need for that here.
Yeah, well,
Well, I'm just reflecting on the presentations that we received over the first few weeks of January, where a lot of administrators were coming before us and speaking about how helpful the tutors and paras were on site.
Right.
And right now we're looking at making some hard cuts to those positions. Now, the ARP ESSER thing, that's another whole nother can of worms we have to discuss, but things beyond that as well now, we're moving into that territory. So, I think, we're kind of an all hands on deck situation here.
That's why I don't. Here was my argument, because I was not in favor of it. I did vote for it because I wanted unanimity. I can't even say the word.
Unanimity.
And at any rate, here's what I said. We spend our lives as educators teaching kids to do the right thing. And if you make a promise, then you keep your promise. Then I said I can remember Rich Stankiewicz, who was here. I don't know if anybody remembers Rich, but he was a great guy. At any rate, I remember saying to him, you're the special ed supervisor. And how would you feel if your kids came to you, you're teaching them, and your kids came to you and said, well, I know I gave my word, but now I'm going to withdraw it. We don't teach kids to do that. And we shouldn't separate the example. That was my argument.
One other
Matthew and then you.
One other quick question. Well,
It wasn't on.
so one of the other options we were looking at was getting on the state partnered insurance plan, and you were going to reach out to MDG consultants.
Yes.
And from what I understand, that you did reach out to John Burt, and John Burt responded to you saying that MDG ran the numbers and said that it was not advantageous. However, we have not received the report. We have not seen the numbers ourselves.
I asked him to forward the report. I didn't want to take time this evening to have MDG zoom in if they didn't have, a path forward with the partnership plan. As of the time we went into the meeting, I haven't seen it. So I'll ask Town Manager Burt if he can forward that forthwith. I know it's a large document. He didn't happen to share it with you.
Has anyone seen the document besides the town manager?
I have not. It's not sent to me.
Hmm.
All right, so I'll follow up with the town manager.
And yeah, that's my only concern is because, my experience with the town manager is that occasionally things do get lost in translation. He's been incorrect sometimes in relaying information from a third party to a concerned party. So he has been wrong before.
He did indicate that they reviewed Dave's suggestion to use the 91% funding because that tracks with the activity in the health insurance account. So they were able to confirm that piece of information for us.
I know
And he
Matthew
confirmed the
has,
Matthew and then Jen.
I'm just asking that if sometime during this meeting, if I could repeat what I said, not now, but at a point.
Okay.
Okay, so my understanding is now with regard moving our ESSER personnel to our budget, we're down from 43 to 36. So
Is that right? Is that the right number? 36? Yeah.
but let me go on and
Yeah, go ahead.
you'll fill in the correct
Yeah,
number.
we
I'm
will.
not worried about that. What has never been clear to me is why we hired predominantly tutors instead of hiring some tutors and some paraprofessionals. I would expect, and this is a presumption, that there are certain instances where the students will need the skill set of somebody who is a tutor with the requisite collegiate training for that. But I'm wondering whether or not there are any of the current tutor labeled positions that could end up with the same equal or better results, or just equal results, if they were performed by a paraprofessional, and whether, given the differential in cost to the district, if we could get two paraprofessionals who can do the same outcomes for the cost of one tutor who can get the same outcomes, is this something we could consider and consider rapidly?
So I'm going to have Denise answer why paraprofessionals are in place based on IEPs and federal law. And then I'm going to let Lori tell you how easy it is to get a para. So
Well,
I'll
I
start with
understand there's
Denise.
challenges.
I'll start with Denise.
Thank you, Superintendent. So paraprofessionals provide a valuable service to our students, and they are recommended through the planning and placement team process. Basically, what they do is they provide additional practice, additional review, and support with daily living skills to students who need it per the IEP. And up until last year, most of our support positions were paraprofessionals.
But a tutor is able to do instruction in
Sure,
small
a
group
tutor, yep, a
one-to-one.
tutor can deliver initial instruction. They have a bachelor's degree. They can also be alone with students in terms of covering for a classroom if a teacher has a PPT meeting or a 504 meeting or a parent meeting. And they do work more with small groups of students. So whereas a tutor can provide initial instruction and they can cover the class in the teacher's absence, the paraprofessional provides reteaching, practice, and additional review of material that's already been taught.
So then, if I'm understanding you correctly, the functions performed by tutors are not functions that could be performed by paraprofessionals.
Sometimes they overlap.
So then my question was, is there any, I mean, within the 36 that we have transferred, is there any possibility of finding sufficient overlap that we can take advantage of the cost differential?
We've really, I think we've gotten down to the bare bones with
Right.
this, and especially when you get into the secondary level, you really need people who have, you know, even experience in the discipline as well. Like when you have a math tutor, we usually get retired math teachers to come and do that work. So it's really important that they have that level of expertise that they can assist the student.
I would just add, up until about a year ago, year and a half ago, paraprofessional, we were meeting our paraprofessional needs. Over the last year and a half, returning from COVID, it's been really challenging to find those individuals. So we did actually shift some of our strategies to be sure we could service the needs of those students like Denise was describing. And in some cases, we did allocate a special education tutor specifically designated for special education, where we did group students where it was appropriate. So we had been doing some of that, but this budget and correct me if I'm wrong, Dave, but this budget contemplates going back towards the paraprofessional model. And that has already been included in this budget, where there would be some salary savings from the difference of hiring a paraprofessional versus a tutor.
That's true. I
So
forgot
we
that
did
part.
contemplate that already, and those savings have already been included, but correct me if I'm wrong, Dave. Yeah.
So one of the questions that I heard at the joint meeting was if we, the town, goes for the initial ask before we got to it, would this be a one-year ask, or would this be something that would become permanently embedded in the budget? And not that I'm against it, but I really wanted some clarity on that.
Well, we're already preparing for the 2025 DODEA, and we did add extra tutors in that grant. So should we get that 5-year grant, we're going to have a little bit of support added in there too.
Wonderful. Thank you.
So it might be that we can reduce a few because of that, should we get it.
And I just want to clarify, some of the focus of the shifting really has been around the special education tutors. I know we've worked hard to try and retain in the budget as many as we could, the literacy, math, and EL tutors.
Right.
So we've tried to focus our efforts on retaining those and shifting some of those special education tutors to special education para educators.
And the SEL tutors, especially at the elementary, they did not want security guards. They do have DARE officers that coordinate and go visit the schools several times a day. And so we have that allegiance with our partnership with the town police and city police, but they really see the value in their SEL tutors. So they are keeping one at each school.
Okay. Thank you.
Jen?
So the last meeting, I ended it saying that this wasn't sufficient, like the reductions, right? And I had concerns about the OPEB payments. I know, I guess, the town manager said it was okay, but in my opinion, this mess was, the situation that we're in right now we should not take advantage of that 1.6 because we could potentially be creating an issue further down the street, or because we're just kicking the ball.
So those are the excess costs. I think you guys could explain the OPEB a little better, but those are beyond, those are in the reserve. So just like we did with health savings reserve, but we did it too often, but we were asked to do it every year. So we know we can't do that anymore, but this is just for 1 year.
Yes, so where are you gonna get the 1.6?
It's in a reserve of OPEB. It's reserved OPEB, additional reserve.
So if you take it out this year,
Right.
right, where are you gonna get the 1.6 so that you have to pay it up next year?
So there were additional funds, right?
No, I think we're bare bones.
No, so,
not hearing that.
Jen, I think that the anticipated claims that we would have for OPEB next year are 1.4 and change. I don't know the exact number. And we have a reserve somewhere in that same range, about 1.4.
Okay.
The difference between the 1.4 and the 1.6, just to ground you a little bit, is when the actuaries prepare the report, they want you to invest an additional amount for potential future claims, anticipated
top
future
of the
claims, on top of the 1.4. That's how you get to the 1.6. So taking out the 1.6 just means we don't pay the $200,000 for future claims. And then we just use whatever the balance is our reserve to pay the normal claims for that year.
So because the actuaries didn't come in, right, they had made an assumption, right, like of like our assets and how much we are gonna get, right, to replenish the funds. So I really do have a concern. I feel like, I don't know what that saying is, like far from Peter to pay Paul, whatever it is. But I feel like we're kicking the ball just down the street, and I really feel like we're going to expose the town by doing this. And we need to really look, in my opinion, elsewhere. I'm totally in a disagreement.
So the town has asked us with the health reserve to take from the health reserve for the last, at least, I don't know, probably since Dr. Grenier and I started together.
Yes,
So
but I
we've
believe
asked for
what
that.
we had in the health reserve was significantly more. And so there was an opportunity to remove, whereas if we remove from this 1.6, I think we're creating an exposure. That's just my opinion.
Well, I do know that, Dave, did you speak to Milliman? Or? Okay, so they're the actuaries.
Absolutely.
And they said this could be done.
They said it's not a requirement to make the payment. You know,
Right.
they always suggest they should because that's going to follow their models, but it's not a statute. It's not a requirement.
Right. And I know that there are a number of towns that are on a pay-as-you-go.
And he said
Okay.
that too.
So, okay, that's one concern. Another concern that I brought up in the last meeting was more of the reduce the tutor hours by 30 minutes each, right? So if we say there's roughly 36 tutors who are going to get 30-minute reduction, right? So every day, every week for the next 9 months, they're going to be like, I'm like working 30 minutes less. Right. So that's like a feeling that a tutor gets. And I had said that if you remove 3 tutors, at least they're gone. Not, I feel bad for the 3 that will leave. However, the remaining 36 won't be miserable for 9 months. So that's something like I had suggested that you guys consider. It's better, like, are you impacting 3 or are you impacting 36 for 9 months? And then that's just something that's going to eat away at them while they're at school. So that's totally a management.
And I did share with you, Jen, that that's 15 minutes before the school day starts, you know, and so they're really able to cover their bases from the time instruction starts and instruction ends. So the duty part and the getting kids on and off the buses doesn't require tutor's expertise.
Nope.
do that, so.
We shouldn't be having somebody who's making $30, like escorting somebody to
So
a bus.
that's where that 30 minutes comes in, 15 minutes in the beginning of the day and 15 minutes at the end.
And number 3, okay, so I know everyone's like concerned about the tutors, but keep in mind, it's double what we had. So thank you for looking that up. I was the one who asked for that. So pre-COVID, we're at 16 to 18, and now we're at 36. So that's still double. Everyone who's looking at it may think it's a loss, but it's still double from what we had. And so I would be grateful for that. And one more thing, and I can't find my notes on it. I'll come back if you don't mind, Jay.
Was that you or is somebody else?
Yeah.
I wanted, I apologize. I wanted to,
Bring the mic up to you.
okay, I wanted to repeat what I said before because my mic was off, and I want everybody to hear exactly how I feel about this and what I felt when we took that reduction. Well, it wasn't a reduction. It was a freeze on our pay raises as administrators. And I felt about that then, and I expressed this to not only to Mitch Stackenwitz, but also to a student that I had in 8th grade, who was at that time a part of I think he was a part of the Republican committee. But this is how I feel about not stepping up and completing, I guess the word is, our word. When you give your word, and I said this to those two people, that we teach our children to give their word and keep their word. And we don't say, except when it's an inconvenience to you. You just do not break your word. If you signed a contract, that's what you meant. And that's how I felt then, and it's how I felt now. I did, however, vote for the freeze because I wanted to keep a spirit of solidarity among our union. But in my heart, I don't believe that's the right thing to do.
Yeah, I just wanted to express my opinion that it seems like in the positions that are being cut, we're hitting the lower hourly and salaried positions pretty hard. And I don't see any higher end or higher paid positions on these lists of cuts, like positions that pay over $90,000 or $100,000. And if we feel like we can take some efficiencies that are affecting the children directly, I'm wondering if we can take a deeper dive into kind of the operations side of the district to see if there's any efficiencies there. Just I would just prefer to see, like, I mean, there's obviously everyone that gets cut is an extremely hard, but it's extremely hard to cut positions or people, because positions are people. Also, I don't want it to be forgotten that we're cutting 6.5 teacher positions in this. And these are frontline, people that work with our children. And should we be cutting teacher positions? Can we afford that?
So those came up through attrition and also from some of our class sizes that vary in the middle school and what we know in the middle school and high school, in the elementary end. So we know for sure now there's scheduling being done now. So there may be even more areas that, through our, retirements and then also through the scheduling process that we're trying to get those class sizes in line with what your maximum number is, which is 20 to 24. There are going to be resource room and there are going to be task classes and other classes, special ed, that require smaller numbers. But in most of the core classes, we're seeing about 20 to 24, and even in elementary, although sometimes they slip to 17 if a boat goes out, and then they'll fill up to 22 within the same year. So we do have to monitor that. So just to know that we knew we could do that just by looking at our numbers.
Yeah, I agree that, you know, it's obviously much easier just to not fill a retiring position than to let somebody go. And I'm just wondering if it's a good choice that we don't fill positions when we have clear need for teachers. I mean, we need teachers to do extra help and sped services. I mean, like, I don't know if, I think our numbers, and somebody can correct me on this, but I believe our special ed teachers are at capacity with their caseloads, correct?
We monitor
I know
that.
we
How
had
many
some-
times a year, Denise? Special ed teacher caseloads, we monitor it about 4 times a year with the administrators to make sure that they're in line.
We monitor them monthly, and they vary. It depends, because children leave, children come in, children are exited, children qualify. So it's a fluctuating number.
And there's enough, I think, at every school that they take it on so that we kind of keep it balanced, right?
Yes.
So, all right, so I just wanted it to be clear that we are cutting 6.5 teaching positions in this budget. And, you know, I just want everybody to, you know, this shows what we value.
Right.
Like, this budget shows what we value. And I personally think that things could be moved around a little bit.
Ian and then Jen.
Well, to build off your point, Adrian, and you know, to respond somewhat to Andrea there, you know, the solidarity, the spirit of shared sacrifice. I share Adrian's concerns that I'm not seeing a lot of sacrifice happening up in the central office area. And one of the things I said at the joint meeting was that, you know, we need to focus on areas that, you know, are not directly impacting students. Right. So, you know, that's why I brought up the wage freeze, and how, whether it's union or just non-union positions, either way, I think we should entertain that notion, at least run the math on it to see what additional savings could be added in. So in the spirit of shared sacrifice, you know, we're sacrificing teachers and tutors. Okay, so maybe there is some expendable situations there, you know, in the sense that, you know, we brought on a heavy load of tutors to get through the COVID situation. And now we're getting back towards normalcy. We can reduce down to a lesser amount. But, you know, again, you know, to minimize impact on students, you know, some of the teachers, maybe attrition, maybe there's some other shifting around. Again, you know, information has been hard to come by as far as full context over the past 2 months that I've been asking questions. So it's hard to get a handle on that, but I share the philosophical concerns that I'm not seeing a lot of shared sacrifice here, you know, between the upper levels and the lower levels of the hierarchy of the district here. And so that's why, you know, maybe it's not a whole union-wide thing. Maybe it's only anyone over $100,000 takes a wage freeze for a year or 2. Let's run the math on that. We owe it to the district, we owe it to the students, we owe it to the community that we're elected to represent, to run multiple scenarios and look at all options.
So there's very few directors up here. You have a finance department, you have a human resources department, you have Sam that does facilities, transportation, and food services. People wear multiple hats here all the time. HR works very closely with the finance department. I have one assistant superintendent. There used to be a director of teaching and learning, and there were about 6 coordinators that sat up here. They're all gone. So then there's my office that is running everything from board things to the whole district. So it's not like there's a lot of directors here. Denise is with the, you know, the AGSA union, and she is, you know, in charge of all of special education and pupil personnel services. So even for our homeless families, she's the go-to person when they need their support. So it's not like there's a lot of extra people here who are in a leadership position, and we're running the central office, which is the hub of the district that helps support our schools. So it's really necessary that we have these key people. When I came here, there were more people, but we've really aligned it quite a bit in the 10 years I've been here.
If I could
Yeah.
add. When I was here, and I would think at least until 10 years, well, my first 10 years, we had 5 assistant superintendents.
5?
5.
I don't know what I would do with all of them.
Now we have 1.
Yeah.
So we've made progress.
Quick question, just to follow up on that. How many consultants do we currently have in the district, and what are we paying them?
It depends.
And
on
how
the
are we paying them?
consultant. There are consultants that are in Title I grants that are helping with behaviors.
Mhm.
There are consultants that are BCBAs. There are consultants that do some work with us in, in different disciplines.
Do we have a centralized database of all the consultants that we have on
I'm
contract?
sure we could dig it out, but it would take a lot of time, and we're in the middle of a budget process. So even doing the FAQs has been enormous
Mhm.
work on my whole department. And they've tried to do the best they can, and they've done a spectacular job, but it's stopping us from doing the budget work because we're answering the questions that sometimes relate to budget, but sometimes don't. So I'm just saying, I'm just putting it out there that we could probably come up with something, and, if we got Dave the right tools that talk to HR, that would really be a big help. So that's the next thing on my list, to find funding for that.
But right now, it's not even in the budget for that financial tool,
Right. So we have
Right.
to figure that out.
so.
Yeah.
So we don't know how many consultants we have or what we're paying them,
Well,
or how,
we could find that out. We just don't have that.
but we don't know.
I don't have that data right now.
Okay.
You didn't ask that before.
I did, it was in the FOI request that I submitted 2 weeks ago, and it's not in the spreadsheet.
One of the things about FOI is that if the document doesn't exist,
Right. We don't give it to you.
We as a board would have to vote to expend, excuse me for hitting that, to expend the time and funds to create that report. So if a majority of board members feel that that would be important information, we could certainly direct the superintendent to create the document.
Well, if we're looking for, least amount of impact on students, we should get some idea of what consultants we're paying, what they're supposed to be doing, and how we're paying them, whether it's through budget allocations or through grant allocations. And, we don't know that information, and I'm frankly shocked that we don't have a centralized database of that information.
Sounds to me like they're funded out of different areas.
Mostly
and
grants.
So, yeah,
They're mostly from grants. They're not in operations.
right. So,
So whether it's IDEA, the one that I know that we've had in Title II for many years is a behavioral expert. And she's changed the culture and climate of our academy programs and our schools, made them so much better, works with administrators. And she actually does work for our paraprofessionals and tutors and teachers, giving them tools in their toolkit. So that's one that I know off the hand because we have had her for several years, but under a Title II, and Title II is directed for social emotional learning. So with these grants, they have specificity around what you're trying to accomplish. So they have to line up exactly with the grant. So that's one example for you.
I remembered what I was gonna say. I think I was next.
yes.
Okay. So I sort of did a rough math on that merit thing. It's roughly about 70,000 just in the department that you're just asking about. Like I did it like as part of my little homework when I
Oh, which department? I'm sorry.
the central office, business office,
Oh.
whatever it was, like whatever page that was, it's roughly 70,000.
If we did
Yep. I just took
Yeah.
like whatever the I added up like 2 pages. So I have that.
was that just for over 100,000, or was that
No, it was
That was the
whoever
whole
was in
thing?
like those 2 pages. I'll look up the page
Okay.
number. It was 67, so I'm rounding to 70.
Yeah.
Um,
So, I mean,
so
while that may
that's-
not be a great sum, it's
No,
still a matter of
it's a matter-
principle
yes.
and shared sacrifice. And it's $70,000. That's, you know, that's a teacher's
Well,
wage.
and I've also
you know.
said
Agenda's
this out
up.
loud, and I'll say
um,
it again. Can I just add this? That central office is the place where 12 months a year in the snow, all the time, early morning, these are the people that are working 24/7 to support the
I
schools.
know, but what,
And we typically have always gotten whatever the contractual raises, they're in line with the contracted raises. So that's been kind of historical,
yes.
what has
so-
happened here in Groton.
No, I'm just saying, like, we're in a bad situation right now.
Yep.
Just because we're talking about it doesn't mean we're gonna act upon it.
I know,
I'm
I'm just
just
sharing that
throwing
piece.
ideas out so that like we all come from a different perspective so that we can like as a committee review. So please don't take it like that I'm attacking the culinary team because I wasn't. So here's some of the things. Other ideas, and they're just ideas, right? There's 2 elementary schools that have 2 assistant vice principals, right? And all the other ones have 1. So we need to understand why the 2 schools have 2. That's just like an item, right? There were behavior analysts. Could our assistant vice principals take on some of that role? And do we really need the behavior analysts? You know what I mean? Unfortunately, software, we know we need technology, but can we hold it off for a year, right? That's another item. The merit, we've already talked about. And there's a lot of other items on this list, but those are just things for the board to consider. I know there was concern about, looking at the lower levels and stuff. So if the comment is being made that there's a contractual agreement with the professional staff, but then we're asking the hourly staff, i.e. tutors, right, to take on like a reduction, even though it's not like a merit reduction, the fact that you're reducing their hours is basically impacting in the same way. It's just something to think about.
Thank you, Jen.
You're welcome.
Can I ask a question?
Mhm.
The 2 elementary schools with I should know this, but it's gone. Did they combine schools so that the number of kids are the same, is the same?
When
They
I,
are.
Yes.
Thames River is really a combination of Mary Morrison and Pleasant Valley.
That's what I thought, yeah.
And it also includes the academy program, so it has high special ed needs in all the preschools. So they have about 550 children, which is kind of double the size of a
Yes.
Farnham. And the
That's
same thing is true with Mystic River. Mystic River has all of the ABA program students with autism, and they have all the preschool pre-Ks. So they have really a heavy lift, and we're fortunate because we have the additional assistant principals at each school have a specialization in special ed. So they do a lot of that work, and they have a lot of behavioral training as well, but we still need the BCBAs on top of that. But
So
you're
my
right.
po-
I'm glad you
yeah.
asked that question. And that was from Claude Chester and SB Butler. So those were
That's
two
what I
schools that
remember,
came
but I
together.
wanted to be
Right,
sure.
right.
Oh, and that was my point.
So we
may
didn't add
have-
staff. We just
we-
took the staff that we had,
So we have fewer schools, but we just have just as many children.
just as many children.
So then you need that extra assistant principal.
Matthew.
Thank you. You may recall that the last thing I said when we had the joint meeting is how conflicted I was and how difficult it was. And I've tried to give it a lot of thought. You made an eloquent presentation. You made a good presentation. You, Miss Susan, you made a very good defense of the budget and how you understood it to be the best budget we could come up with as a first pass, because it's a superintendent's proposed budget.
Right.
I listened not only to you, but I listened to what I saw on the members of the RTM and the council. I listened to the words and I looked at the nonverbals. And I guess the word isn't disturbing, it was concerning. That's the word I'll use, concerning. You explained about inflation, contractual obligations, health insurance, loss of DoD supplement, COVID's residual impacts. You made the case. And yet, the message I heard was if we don't sharply reduce the budget according to what we think it should be reduced with the least amount of damage possible, it was going to be done to us. That's what I heard. So the last thing I want to do is minimize services directly to kids. So I'm ready to get shot now because I'm going to talk about that. We pride ourselves in the breadth of elective programs we offer. And I think we should have open enrollment to all of them. But that the time may have come to say we set a threshold. I'm not here to tell you that the threshold should be 4 or 6 or 8. That's a operational decision for you, Susan. But if we don't have the threshold, we may not be able to offer a given course, a given semester, a given year. It's painful. It bothers me. But that's a place we may be able to reallocate some staff so that if we do let attrition take some people away, at least we have freed up a couple of teachers for classroom activities. The other place that pains me is class size. If I understood you correctly, we're talking 20 to 24 as a class size. I know we have contractual obligations in the contracts with the teachers. I am not in any way, shape, or form suggesting we try to amend those. Those are maximum. So it's a two-part question. Can we consider the effects of a slightly higher class size? And then if we were to do it, you know, if we went from, I'm going to say an average 22 and a half, 22, I'm just going right in the middle. If we went from 22 to 25, would that actually free up some teaching positions? Because, you know, if we have larger class sizes and we don't have any savings, there's no point in doing it. But I think we need to do this because I'm just afraid if we don't figure out some serious cutting, we're going to get cut for us, and then we're going to have to really play cut and fill. I'm sorry. I expect to get some very nice emails. That's life.
So we are doing the scheduling and we are looking at those numbers to average closer to the 22 to 24. However, Fitch High School cannot have more than 24 by fire code. So we do have building issues that are limiting us. We also have space issues at the middle school, but I'm hoping if we can fill up those class sizes better, that will also alleviate a little bit of trying to find classrooms for these classes. And they are looking at your suggestion about looking at enrollment. We've done some semester classes for those really high, or highly appreciated classes, and we've looked at running some classes on a semester or on a year and off a year so that they fill up, you know, and the work is being done now. I know Clint is working with teams at the middle school and high school, and he, you know, they're really working hard. They're getting the training themselves, which is really important for the administrators and the counselors to get the training. So when these people go away who help with Power School Scheduler, that they'll be able to continue that work. So, you know, we've set those parameters, and the kids are signing up now. And once the kids are signed up, we'll have a better idea of how those classes are generated. But thinking in the same vein that you are, believe it or not, that, you know, we can't run everything all the time. So we might have to make some decisions, some hard decisions that a class wouldn't run this year because only 8 kids signed up, and we'll do it next semester or next year, depending on if it's a semester course or a year course.
One more last item, if I may, Jay. Athletics. I do not want to see any sport, intramural or extracurricular or interscholastic, eliminated. We make very clear. But I think if we're talking about sacrifices everywhere, even if it's just a nominal sacrifice out of the athletic department, because the kids have to realize that life includes sacrifices. I don't know where, I have no advice other than to perhaps ask Mr. Romano if he can figure out a way to put in his ante to this difficult process. Thank you.
Take this pause in discussion just to say that I think it's important that we don't cast any aspersions in our meetings, and I meant no disrespect for the town manager. When I mentioned that he said he was sending me some documents, he's a very busy person, and I'm sure that I will be able to share that document with you very soon. I think the message is that unless anyone else objects, I don't think that there's a opportunity to Zoom MDG in tomorrow night to answer any questions if there's no path forward with the partnership plan.
I would just like to see the report.
Exactly.
I just want to be able to review the data straight up.
Yep.
I don't want to take somebody else's
Yep.
representation of that data.
Well, I just, again, I'd rather we not cast any aspersions on his, I know he works around the clock, as does the superintendent, to run the town, so I will reach out to him.
We did have one more thing to share about the nurses, if you would entertain that idea, because we did talk to Mr. Burt, and the town actually has the 1.3 million, or I think they have last year's contracted amount in their budget. I'm not sure if it's last year's or this year's. So they've always done that, but as you know, the VNA has taken away their services, and it ends at the end of June when summer school begins. So it's really important. There are 4 districts that have been impacted. We've all been collaborating. We know that Learn has some resources that could help us to kind of get started. I know that John still has that funding in the budget, and we've done a little bit of lead work. So I know there was a question too about school-based, our school nurses, and then school-based health, and couldn't the school-based health just take over those services, and then we wouldn't need school nurses? But the answer is no. Denise has the kind of the legislation and the authorization. So there's a student health services document in front of you that talks about the school-based health program on one side and the school health services. And she's going to kind of explain that. And we've done a little bit of number crunching. It's not done all the way, but we do see that there's going to be some savings for the town by taking our own school nurses back, having one of them be the lead, and then working with Learn to collaborate. And I think there might be some insurance involved too. Lori, I think we had heard that too.
Yeah.
So Denise, you want to explain this?
Sure. Mark, the presentation isn't showing in this room, but everyone does have a copy. So I'll.
Did you try to
go
share
ahead.
with them?
Yeah, Dave's sharing. it
Dave's
now.
sharing. There it is.
There we go. Thank you, Mark. So I reached out to Dr. Anna Goddard. She's the managing director of the School-Based Healthcare Center. And the School-Based Healthcare Center is managed by Child and Family Agency of Southeastern Connecticut. And Anna shared with me that the Department of Public Health, who oversees this grant to provide the school-based health centers in public schools across the state, actually has a letter of assurance that's included in the contract. And it specifically stated that the purpose of the school-based healthcare center is not to supplant the services, the nursing services provided by the school district. So we're specifically prohibited from using the staff at the school-based healthcare center to provide school nursing services. So that was the first piece of information I wanted to share with the board. And then the second piece is just to give you a little bit of a distinction between the roles, because the roles of the school-based healthcare center staff and our school nursing staff are very different. The school-based healthcare center is actually considered an outpatient medical center, with the only difference being that it's located in the school building. And they provide primary care services, physicals, immunizations, ongoing counseling, prescription medication, services that you would normally receive through your primary care physician or your behavioral mental health clinician. Whereas the staff in our nursing office really provide services that allow children to attend school, focus, learn. So for example, if they're sick or they're not feeling well, the nurse is very important in making sure that, are they well enough to stay in school? Do they need to go home? She does certain screenings like vision and hearing. She certainly helps with medication management with parent permission. And she also interfaces with that child's primary care physician, because some students who have life-threatening food allergies or chronic medical conditions need what's called an individual healthcare plan. So, and the nurse creates that in consultation with the primary care physician, so that all of the people who work with that student are aware of what that health condition is and how to respond if that student has an emergency. So the roles are very different. The staffing also consists of, at the school-based healthcare center, they employ nurse practitioners and mental health clinicians. Whereas in our nursing health rooms, we employ RNs, and then we have a school health aide that supports the RN. So there's quite a few differences in their role, in their scope, in their mission. They are all healthcare providers and we work collaboratively together, but the roles are very different. And the contract really forbids us from supplanting our services that we currently provide through the VNA with Child and Family Agency.
And all of our students have access to the care of our school nurses for the complete day, where these, the school-based health is not there full-time at all of our schools.
Right.
And, they're part-time and they have to have the parents' insurance to cover them. And then they also have to have the parents' permission. So it's really for only the students whose families have activated that service. So that would not help secure us for all of our students.
Correct.
And they don't have enough staff that could handle. And then they have the
Correct.
the legal information. So
Clarification, does this mean that if a student's family didn't have health care insurance, they would not be eligible for the care? Did I misunderstand that?
I don't know.
No, they see all students regardless of their ability to pay.
Okay.
Oh, the school-based health?
School-based health.
Oh, okay. I
Okay,
didn't
thank
realize
you.
that.
They do.
That was a good question. But I do know that they do
Yep.
accept Husky.
Oh,
and
absolutely.
TRICARE
Yeah, they will
those-
help
yeah.
parents connect with Husky, help them in the application process, and they also have a sliding scale. But one of the primary missions of the school-based healthcare center is to serve children who are underserved in terms of access to health services.
Well, the clarification was clear. Thank you.
And they are really grant funded and we've written
Yes.
testimony and, all the superintendents who have the
Mhm.
school-based health programs, we've really set that up for
Mhm.
legislators to really know how much we do appreciate it. It's a wonderful resource for our
Right.
schools, but it just can't take the place of the school nurse.
Has there been any discussion with the other districts that are also losing the VNA to share some of the supervision and
We
maybe
did
the
talk about that.
insurance,
Yep.
pooling the insurance or something?
I definitely asked about the insurance. We did talk about that. There is someone at Learn and she services the Learn schools and a couple small schools, but she couldn't give the total supervision support. She could support our new supervisor in her role, and she would be a great asset. But she couldn't take the 4 districts. Groton, of course, is the largest, then New London, I think East Lyme and Waterford. So we're talking about, really finding someone who's already a nurse who can, you get a stipend
Right.
and then be able to connect to learn. So we are talking about some shared services, and then the professional learning, the Learn can do the professional learning for the nurses because there's a requirement on how many hours training they need each year.
So at this
But I
point,
like the idea about the insurance. Maybe that's something we
Yeah.
can look into.
so this VNA contract comes to an end on
June 30th.
June 30th.
And summer school starts July 8th.
Right. Has anybody reached out to Yale just because wasn't their purchase of VNA something that was regulated?
Well, Yale is their parent company, Yale New Haven Health.
Right, but they weren't always. I believe Yale acquired them. And I mean, you know, is it worth reaching out to Yale and just saying, you know, June 30th, we have summer school. Can we just extend this? You know, reach some kind of agreement, given that when they went through that process of acquiring VNA, I'm told, I'm not an expert on it, that maybe the state had to approve that merger or that acquisition. You know, and were there any requirements that they provide, you know, these kinds of services for a certain amount of time?
Jane, I don't know what the regulatory body is, but they clearly had to go through a regulatory body. Contacting that regulatory body might get a quicker, clearer answer.
Yeah, and I'm just saying, if we reach out to them and just say, this is a real burden on our students to end it on June 30th, given that, you know, school might end, but
Right.
there are things happening all
We did reach
summer.
out to Hartford Healthcare, and we did reach out to William Horgan, and he really promptly gave the information to the CEO. But we've had numerous phone calls, and we've actually reached out back to him, and he was going to remind her to make the phone call back, but
Yeah,
we haven't heard yet.
we've not heard back. And we did get an official closeout letter from the VNA and Yale New Haven Health.
How many nurses do we need in the summertime? We have
The summertime, we need one.
just one.
One nurse, and since COVID, we have had a health aide. And I will say that it's been very helpful.
So I think that we'll be able to at least hire one of our own nurses to take care of.
Yes, and we have the health aide in the summer also because the high school runs their summer program, their credit recovery program at the same time as we run ours. So our nurse is on call if there's an emergency. So the health aide covers the office if the nurse has to leave.
So we are exhausting the resources. There was quite, I think, an upcharge for VNA services based on looking at the salaries and then what VNA was making. It was quite significant. So we thought if we can do this in-house and we can save the town, you know, several $100,000, that's a good thing. Especially since our nurses want to stay and we want them to stay. So we're still working through it though.
So what are the implications of this for the budget decisions we need to make in the next few days?
Well, John's holding on to this budget item in his budget. So he's got it, you know, that number, 1.3 million, and we think we can come under it. So whatever the decision of the council is to make sure that whether it gets transferred over or whatever happens, happens.
So this
And if
is-
it's a contract, if it's something with Hartford Health, then he would just manage it like he's done in the past. That's what I understand.
Because he does provide service to another private school in town.
Well, that's another important thing. So tell them what you found out about Sacred Heart.
Oh,
So that's
sure.
by law.
Sure, so there's
Towns have to
actually
do that.
legislation that requires that if there's a private school in the district and the district is providing nursing services to their schools, the district is required to provide similar nursing services to the private school.
But I thought the legislation clearly said the town provides.
It does say the town or the regional school district.
Okay, all right.
And luckily, there is a reimbursement grant at the state that reimburses the districts or the town for a portion of the nurse's salary at the private school. And in our district, that would be Sacred Heart. So the town for, I think, 25 years has provided a nurse to Sacred Heart School. And we certainly would want to continue that to support them in that way.
just going back to core competencies, right? Like if we take on the nurses, there's gonna be a nurse administrator I'm sure the VNA may look like they're making money or whatever it may be. But then we would have to worry about like all of the medical supplies that we need to buy and purchase and all of that. Do we do that or
We
does
already,
the
we
V?
take care of
Okay,
that.
we do, the VNA doesn't,
we
they just
currently-
come in. Okay, so we already have
Yeah.
the skills. Okay,
We
I just
provide,
don't want us to.
I know,
need to
you don't
pay-
want to take on more than we
Mission
can chew.
creep.
Exactly.
Jen, we,
Okay.
we purchase all of the supplies for the health offices.
Okay, perfect. Thank you.
But in terms of the administrator, that's why I was hoping if we could.
Yeah, we're looking
Partner
at
with
learn
another
to
district.
partner, but we're not thinking it would be a
Waterford or
full-time
Groton.
supervisor. We're thinking it's one of our nurses already. And we have one that actually had applied for that job and didn't get it. That would do that in addition, so she could actually be the go-to for the other nurses. You wouldn't need a full-time. You would need a really highly qualified nurse who could also be a supervisor, but to have that learn partner who could help train and help support with professional learning would be a real good thing. So we've already made those conversations, but I love the idea of the insurance too.
These are registered nurses, not LPNs, correct?
Correct.
And we don't need an APRN for the supervisor?
I don't believe so.
Okay.
I don't think so.
No.
No.
Dave, have we been told what the cost share is on the building insurance with the town? Now, is that now in the budget?
It is in the budget. If you'd like, I could put the schedule up on FAQ tomorrow.
Okay.
Actually, I think it's already up there, but I'll just double check. I think we
Okay,
put it up there a
all right.
while ago.
Yeah, I just know at one point we weren't quite sure, so.
Yeah, that's already included, though, Jay.
Okay, thank you.
Oh, what is that amount? What's the breakdown?
It's two pieces. So we have the piece that's just the rate increase. And then there's a second piece, which is the cost share based on the value of the buildings. So the town would like us to take on over the course of a few years, take on a larger proportion of the property insurance based on if you just look at the property values of each of the buildings. I think it's already on FAQ, so I don't know the number off the top of my head. It's just, I haven't looked at it in a while, but if it's not, I'll have it up there tomorrow.
Questions?
Yeah, I don't know. Bev, did you have any questions? We can't see you.
No, I don't have any questions.
Thank you.
My only comment would be on the line of what Andrea was saying. I would hate for us to ask the administrators or the central office people to take a pay freeze or a pay cut and not ask everyone in the school district to do that. Because if we ask them to do that and they say no, that's going to make them look bad in the public eye. The public's going to say, oh, look at those people. They make over 100,000, but they wouldn't even take a pay cut. So I am against doing that because I don't want anybody to look bad in the public eye. So if we are planning to do that, we should do it across the board and ask everyone to take a pay cut.
Here.
Just to be clear, it's not a pay cut, it was a wage freeze.
No, I think what Bev is
Well,
saying,
whatever
though-
it is, Ian, it's all the same. You're asking them to take a reduction in their salary. We could play with the semantics, but it's still the same.
That's what I was gonna say, you said. That's my take on it.
I'm sure if the
Alright.
state asked state employees to take a pay cut, the union would be up in arms. So
One of the follow-ups on the spreadsheet, attachment 10 was not functioning, the link for that. It was a document that was presented to the Financial Committee, Finance and Facilities Committee a few weeks ago.
It's on the FAQ, you mean?
Yep,
And it's not working.
not working.
Erica's my lady. I will ask her tomorrow morning.
I did send an email about that.
You did, okay.
Mhm.
I'll just remind her.
Which line again?
It's line 98, 96, or 98, I think. Yeah.
Adrian.
I just have, going back a little bit, just a couple little things. The building subs at $600,000. Because we'll have to have daily sub, we talked about this last meeting. I'm wondering if anything's been done on that, because I don't think it would be fair to write a number in there that we're definitely gonna have to hire more daily subs. So we should take a stab at what that is, so we're not stuck with a $600,000 number when the real number is gonna be less than that in savings.
Yeah, sorry, Adrian, so what would you like me to follow up on? You just want to know?
I would just, so if we're cutting 20 building subs.
Yep.
Times 180 days, a portion of those, days, which was, what's that, 3,600, substitute days, is that right? A portion of those days are gonna end up, we're gonna have to hire daily subs.
Daily sub, okay.
In addition to what we already have contract, in the budget. So I just would like that $600,000 number to be representative of the actual savings after we take into account additional daily subs that we're very likely gonna have to hire.
I follow you.
And then just to go back to what Ian was saying on consultants, I feel that, just in transparency, we have a budget, we should know where it goes. And if we want to know how many consultants that we have, it seems like that should generally be an easy number to come to. Whether that's going to happen in the next 3 days, I understand that the hard parts of that, but I mean, that should be, in my opinion, a transparent number for, for the board and for the community to know. The whole budget should be transparent, but specifically with that, I mean, we're talking about a whole bunch of random numbers, and we should be able to assign something to it.
I think it's just man and woman power going through all the grants to find all the consultants, not already on a report. So that would just be hours, labor. So.
Yeah, I agree. I mean,
Yeah.
I think it would be unrealistic to expect that it's going to come in a couple of days. But I do think that would be a reasonable thing just to be available.
Okay.
Right, moving forward. It should be a thing that we have at our disposal.
Oh, if I can,
Yes.
one more quick thing. I know I had asked about this and Matthew had asked about it, but when we take things that we're, moving out of our budget, when we take positions or items or whatever and move it into a grant that's already an existing grant, it's going to offset something. So if we have a grant for $100,000 and we move $10,000, assuming that we're spending that $100,000 every year, and we move 10,000 that's now going to be funded, well, there's 10,000 that's going to spill out that we're not getting, and I would really like to know what that is.
The opportunity cost.
Exactly. It's not just like it can be grant funded. It has a real offset to something else, and I'd just like to know what those offsets are.
Now, also, I know that we received a number of graphs in the beginning about the grants in general, but as far as like grants overall, I mean, do we have a report on every grant as far as like what it's spent on every year, like per grant?
There are grants, they have different stipulations on how they're reported on.
Mm-hmm.
So for instance, our DODIAs have quarterly reports, they have annual reports. So every grant is a little different. titles come in a certain way, so you have to report out on them. So there's a lot of reporting going on with the grants.
Are those
So-
reports something that we can see?
Yeah, absolutely.
Could those be added to the spreadsheet, the
I don't know if I can
FAQ
get it
sheet?
to you that quickly, but I can, I don't know if I can get that to you. I mean, though, that really doesn't have anything to do with the budgets, but I can,
I would beg to differ. I mean, how we spend the
reports are
grants.
how well the work has been done. So it's not the actual grant, it's the reporting of the grant. So you have to have goals and objectives related to teaching and learning.
Mhm.
And then how are you measuring those goals over time? You do quarterly reports, you do annual reports, you do final reports. So it's really all about the grant's work.
I was also thinking about the money, as far as like the grant monies. Where were they allocated to? What were they spent on?
Like I said, that would just be, labor to go through the grants to gather them.
So that's
all.
not a thing we do on standard practice? That's done periodically over the time
We
as the grant's
do.
allocated?
In my department, that's what we work on. That's our work. Absolutely, we do.
So I'm understanding you to say that the reports are work product reports, not financial reports.
Yeah, if, that's what I was understanding you were asking about the reporting, is that it's not financial reporting except for, I guess, Dave, in your office, right? When adjustments are made with grants or grants are spent and then they're reimbursed, that all goes through your office, right? The budget.
Financial, yeah, the tracking of the budget,
Mhm.
absolutely.
So those are two different things, I'm thinking.
Okay.
What I was understanding from you. So there's the reporting of the grant that talks about how we're measuring the grant and the work that's being done in the grant. And then there's the accounting piece of managing the monies and the
Right.
funds.
And the two reports are not integrated, they're separate?
They're separate, yeah.
Okay. Are those financial reports available as far as like, periodically, how often are they updated?
Yep, they're
How-
usually, they're updated. I don't know if it's just about monthly, it just depends on the frequency of the activity within a grant.
And in those financial reports, is there a description of what the grant is and what the parameters are?
I don't know about parameters, so it's kind of like a budget report, right? It tells you what the
Mhm.
budget is by line, and then it tells you how much we've spent against that budget.
There's no blurb at the top as far as like a short narrative of what the
Well,
grant
when you
is.
apply for the grant,
Not
there's
in that one,
certainly
it's just a pure
an
financial.
application
Hmm.
that we
overview.
have. Yeah.
But it would tell you, if it's $1 million grant, here's how much we spent year to date, and here's,
No.
by line, here's what we have left.
Again, moving forward, I think maybe like having the two integrated to some level would be very useful. Just get a better understanding of how we allocate the grants and, because a number of times over the past, many months, we've found money in grants for things, and I'm just would like to have a better understanding of how the grants work, what grants are in play right now, and understanding like, it is about looking at the receipts as well as understanding like the impact of what those monies produced. So I see a need for sort of an integrated report.
Well, the
To some
grant
extent.
sources, those who make the grants determine
How the
what the
parameters are set up.
report looks like.
Yep.
So
Mhm.
are you asking for the staff to create a new report merging the two
Or just,
dated reports?
2 PDFs in one email.
Right.
Yeah. And then the integration can happen on the,
Yeah, as you're
the
reading,
reader's end.
Yeah, you can.
I could do the integration if I have the narrative report and
Right.
the financial report side by side.
Yeah.
Like I'm not asking for extra work. I'm just wondering like, how do we track these things and how do we
Well,
measure the
that's
impact?
the work of my department. So
Mhm.
that's the work that I do as your CEO, is constantly review these grants and monitor them and make sure they're working. And that's kind of our day-to-day boots on the ground. what we
If I'm
do.
not mistaken, has Shannon come to the board? Shannon Weigel, who's our grant coordinator? Well, I know she's reported out. I'm not sure if it's
I
at
don't know
COW
if
or.
they've had an
at a-
opportunity to.
Well, definitely not
yeah.
since the new board has come.
Yeah.
in, But
She was here a year ago. She was here last.
We try to get her in at least a couple times a year.
She was here last.
yeah, so we do try to provide updates on the grant. That could be at least a gateway
Mhm.
into understanding some of the grants. But I just wasn't sure how
Yeah,
often we've had her
I-
do that.
It was either October or November, I think she made a report.
She does give reports, and I put them in board notes too. I think you've seen her reports. They're pretty detailed on the ones that are pending, the ones that we've already received, the ones that we're looking into. So she has, reports. So I'll see if I can't find one of those. So at least you can see the complexity of the numerous grants that we do receive. I mean, it's
Yeah,
really.
But I could talk to her maybe about a way
Yeah.
that she feels would be a great way to keep the board updated. And maybe she has an idea of
Yeah.
combining, maybe coming to meetings and providing some type of updating the board notes or something.
I'll tell you what I think, and I know this is more money, and so nobody really wants to hear it at this point, but in addition to an up-to-date financial system, a board document management system
Yeah, wouldn't that be great?
where has the repository of everything we need searchable by with searchable PDFs along the lines of our policy manual online. I don't know about you, but when I look at a policy now, I don't go and pick up the
Book.
20-pound book out of the closet. I go to, and so I think we need to look at what something like that would cost. And this could include agendas, minutes,
Word docs, right?
yeah, all the documents, but have it convert to searchable PDFs so that we can find everything we need over time, because I find it, the older I get, the more difficult it is for me to organize all of these sources of information. We had them and I know there are several companies that do it, so I'll make that a point of mine to do some research on what those cost. I know Bev had her hand raised. Are you?
I was just gonna say that I agree with Ian and Adrian about getting the list of consultants. I'm not so interested in the ones that are paid by grants, but the ones that we pay out of our school board budget. And I just want to say, I want to make sure that we don't start micromanaging Susan and her staff. We really have to be careful not to do that.
Thank you, Beverly.
So I will say I'm shocked that we don't have a list of grants because.
We do have a list of grants.
So what
We
I
do
was,
have a list.
what
of
I
grants.
was thinking, and I don't know if this is what you're trying to get, so I'm not, it's almost like, this is my grant. We have 20 grants. The grant value was like $1 million. We've received 500,000. We've allocated X amount of resources to this grant, and actuals we've spent is Y. So it's a very simple document, however many grants, and we just tally it over. I don't want to micromanage like the performance of the grant, but just a list of, here's like our 20 grants, value, receive, expenditures, number of FTEs, because at the end of the day, we're looking at this budget, and this is the budget that only goes to the taxpayers, right? Basically, who's ultimately funding this, and everything that's grant related is not being reflected here. So we don't really know the total budget of the entire school. We only know a portion of it, let's say 80% of it. So it behooves us to have we need to have the total view so that we know if a grant will not get renewed, that potentially this is what's going to come into the budget. And it's just a very simple document. And I don't think it's much to ask, and maybe not for this year, but maybe going into the next.
You might have something like that. I see Dave putting his
Okay.
finger up.
No, I was just gonna mention, in the budget book, there is a grant revenue page that lists all of our grants, and I tried to even forecast out by year over the next 3 years what those look like, just based on, anticipated expenditures.
It's 4 pages in the yellow tab.
So,
4 pages
so
in.
Jen, maybe what it
Page
doesn't
number.
have
Page
is
number.
the
It
FTEs.
says number 4 on the bottom.
Oh, perfect.
of
Okay.
So maybe that'll be a start for you, but I know it
Yeah.
doesn't have the FTEs that you were asking about, but it was, sort of an overview, so you get an idea of just order of magnitude, how many do we have and what
Perfect.
that
This is-
revenue is
yeah,
like.
yeah.
May I?
Yes.
I heard Jen suggesting that, but I heard her suggesting something more, and something that I had spoken about a year ago and 2 years ago. We are not an $82 million business. we are an 82 million plus grant business. I'm going to pick the number 8 million just out of the sky to make a point. So we're a $90 million business. That's not obvious to the council. That's not obvious to the RTM. It's not obvious to the taxpayers. It's not going to happen this year, but next year, I beg us, we have, our budget is this. Less grants, see page 4, taxpayer share.
You're
So,
right.
so they can say.
We try to
"We're-
emphasize that,
we-
that
we-
we are living off of additional funds that really help support a lot of professional learning.
Well, I'm not clear that, I'm clear that we understand.
Right.
that. I'm not clear that the public understands it. And when they see that for the money that they're spending, which is significant,
Mhm.
they're actually getting, it's like buying a stock at 10% below market price and getting the dividend on the market price. I mean, there's a value to this to the taxpayer that's not obvious yet, and I hope it will be in the next round.
Yeah, and a quick follow-up to that, as far as like, you know, it's not so much what I'm looking for is like a micromanaging angle. It's more just a deeper understanding of like how these things function.
Yep, I
You know,
understand
because
that. I would like you to read the reports. I'm kind of proud of them.
Yeah.
And what they've accomplished. So the reports I would love to share with you. I'd love to be able to, at a COW, talk about this more because it's something I'm very proud of and I'm recognized across the state for the work that I do with grants.
yeah, I'd
Yeah.
like to
Are you
just have a,
suggesting 3 cows a month plus 1 regular meeting?
Yeah, no, let's not go there. And I know this is a new year and it's a new year of the way we've done business and we can certainly, once we've come up with air and we've been able to breathe and say, okay, we've decided on this for, you know, for ourselves, we can talk about reflections on how we make it even better for next year. I mean, I think that's certainly something we can do. Because we tried a different way, trying to make it a little more meaningful for you all going through it. And the first year you go through anything, it feels like the deep dive, like, oh my goodness, you know, you need more information. That's why I understand those frequently asked questions too.
It's kind of unfortunate that the budget process starts so soon. I mean, there's nothing we can do about it, but it is an unfortunate thing that it starts so soon after an election and we have so many new members. However, along Susan's lines, I think each of us now has a better understanding of what we need for the next budget. And I think we need to commit to doing that work as soon as this budget.
Yeah,
Is
like when
over.
it's fresh in our mind.
Yeah, I mean, we do have a budget timeline, you know, where we start talking about the budget, say in September. I know nobody really wants to start talking about the budget as soon as we do this budget, but you know, if we're going to bring together all of the data that we need and create this repository that I envision that we can click on and have all the information, you know, at our fingertips and also, you know, to be able to search through it and organize it. And so I don't know if this requires a new committee. I mean, I'm just throwing this out there that we need.
Repository committee.
well,
Well, almost a, you know, a committee to recreate the budget. I know that's sort of in the purview of, you know, finance and facilities. Maybe we give them that
That might
charge.
be a good thing to reflect on it. That
But
would
I-
be a good
But I
committee.
think there'll be times when we need to have them bring that work back to the COW.
Yeah, agreed.
And see where that goes.
Yeah.
So that everyone does have what they need without these time crunches,
Yeah.
you know? I totally respect any member who wants more data and we know it's there. Unfortunately, even in this day and age, it's not, you know, push a button and there it is, but it could become that way. So maybe what we learned from this budget season is how can we make this better for this board and future boards? And, you know, look at how other boards do it as well. I mean, I'm not going to name any names, but I saw one district that they said they were presenting the superintendent's budget on a date in February, and 2 weeks later, the board was voting on it. And I'm thinking to myself,
How did they do that?
how did they cram, 30 hours of meetings into a 2-week period? So, but a lot of our meetings could be more productive if we had all that data right from the start. So, and I think Ian and Adrian, well, everyone has really kind of shown us the way to think about what data we really need to make the best decision, for the district. This is just a really unfortunate year. We've had them before, but with this unbelievable health increase in the transportation, and people still say to me, why didn't you negotiate a better contract with the bus company? If only that were true.
We had 2 bids.
It's a low bid situation. But we do need to also study what alternatives are to the way we currently do busing. So, and again, that's going to take time.
Right.
Anyway, that's my thought. Any other?
Well, I have heard some stories in the community as far as like I don't know how accurate they are, so I would rely on someone with more institutional knowledge, but was there ever such a thing as a budget committee on the Board of Ed?
I saw that on
in past-
Facebook.
Yeah.
I know the person who posted it. Beverly, are you on?
We just can't hear her.
No one is aware. My only guess would be that they were referring to the Finance and Facilities Committee.
Right.
No,
However-
no, Jay, we never had a budget committee.
Okay, I think it was just semantics.
Yeah.
I think that was just the word.
I never heard of a, I've been here a long time and never
Right,
heard of it.
that's fair. Yeah, and it was like anecdotal people talking. So, yeah, I just want to get some clarity on that. I appreciate your comments, and I do look forward to finding ways we can refine this process and adjust the timeline so that, we can better anticipate and better incorporate the health insurance costs. I would hope that we could have that report, the MDG report, to review, just so we know what the real nuts and bolts figures are. Just to understand what factors we're looking at. And again, it's late in the game to try to make that change.
That would have to go through the unions, ours and the towns, or we would have to negotiate a separation from the town.
Mhm.
So yeah, definitely.
It would take time.
Right.
It's almost guaranteed it couldn't be July 1st, but I'd like to see also what other options are out there. I understand the CEA has an insurance plan. I understand that Learn has an insurance plan. What is a fully insured plan look like? But keep in mind, we need to partner with our unions to make
Mhm.
sure that that makes sense for them as well.
Agreed, 100%.
Yeah,
Yeah.
so,
And also, as far as the buses go, I think that would also be a great area of study for the intervening time after this budget cycle,
Mhm.
moving forward before we enter the next one, so that, we have a better understanding of what options exist. And yeah, I think it'd be good to reach out to other districts that have tried to go for the electric grants and see, what their results were and what their processes.
so we asked STA to come in and discuss their pilot in Griswold. They came in to the Finance and Facilities Committee. The last time we checked, when were they here? A year and a half ago?
I think so.
And the last we heard, they still don't have the chargers in place. I don't know what the status of the buses are.
I don't think Sean McKenna has them because we do a lot of our collaborating through Learn, and I don't think they've gotten them yet. They're waiting still.
But Matthew's been a big proponent for, let's get one, right? How difficult would it be to plug one in? You know what I mean? We've
Well-
got chargers at every school.
But are they the
Already.
same? Are they the same interface though?
I don't know.
Yeah.
I don't know. But what I'm saying is, you know, it shouldn't be that difficult to install one.
I was even seeing, we were even sending out, used school buses so we could use them for teams and, music department and, just to have our own bus with a bus driver that we could use. I know Mark Romano's done a great job working and collaborating with the rec department, and he's gotten some of those small buses so he can take small groups of kids to different places and less cost. And then we talked about the opt-out for
think that's a
families that
great
want to
idea.
opt out, and we're going to get that rolling so we can see even this year if people take advantage of it, and that might inform us for next year. If I can drop a couple buses, what would I save next year if I could streamline this? There you go.
Wow.
So,
And again, to Matthew's credit, he reached out to Cabe about the legality because there's an old nutmeg that goes around that we have to save a seat, right, for every kid on every route. And I know you reached out to Mr.
I called up Cabe, identified myself as the board member, said I was not speaking on behalf of the board. I just had a question.
that's good.
And I started that at the beginning and I reaffirmed that at the end. But my question was simply, do we have to have a seat for every enrolled student? Or do we have to have access for every enrolled student to have a seat? And he sent me a bunch of documents, which I forwarded to Jay.
And
One
I will
other
share
thing
those
about
with the
buses, one other thing about buses. In North Carolina, we do a lot of things in ways that we wouldn't want to do, but they do have a thing. Every district has a white bus. It's marked activity bus. And it's shared with the town. And it's shared to the extent that the district wants to do it with nonprofits in the town. And that bus is designed for off-campus activities. It's one bus with a district employee. And, if it goes to Parks and Rec, they have to pay the cost. We figure that out. If it goes to here, they have to figure it out. But we avoid having an awful lot of overtime sitting in a.
Yeah, I get that. That would be good.
And the way they get their drivers is they look for a retired school bus driver who'd love the extra funds. So
Very good.
we can find out more about activity buses if you want.
You'll be sending those documents around to the whole board?
Yep, I'll send everything that Cabe sent to Matthew.
Thank you.
Dave, can you remind me when are we scheduled to get the next health insurance update?
Next week, it's usually, the last week of the month or so.
Okay,
So I'm hoping a few days,
okay,
hoping for another good month too.
Yeah.
right, well. you know,
I do have one, may I have, you want to go first?
Nope, that's
My
fine.
question is, after you guys, administration has heard what the various board members have said, can you, Susan and Jay, give us some feedback on where we go after we adjourn tonight's meeting before tomorrow night's meeting? Where we go from here, how you see us going from here?
And along those lines, I was going to ask if there's a way we can get some, say like a multiple level scenario here. Like we've managed to get down to a 9% increase now, essentially
8.5.
Yeah,
8.5 now. All right, so we're back to the realm of where the initial,
Where we started.
right.
That
yeah.
healthcare was a real big thing to tackle. That was
Understood, and
scary thing.
I think we need to be very assertive moving forward, working with the unions, working with all stakeholders in order to get an idea of what array of options are out there. As far as like the self-funded plan, it seems to be, I have concerns and I'd like to see what else exists out there as
For
far as
the
options
health
go.
plans.
Yeah, for
I
health
think
plans.
Lori's on that too. She'll contact her resources because you had made that point, Ian, that sometimes different people asking different questions, you
Yep.
might get a truer sense.
Yep.
And I will add that because we are combined with the town, there are different advantages and disadvantages that have to be, I guess, considered, understood, negotiated. So that's something that we definitely have to take a look at because we are all together right now. And depending on which options we look at, will have different advantages and different disadvantages to the different bodies. That's something we'll have to consider.
So, yeah, maybe move in along those lines, like whatever we get as far as data to digest, it could be set up as a, pro, con,
Yeah, I think we really have to look at it and
Yeah.
examine it.
yeah. And so, yeah, just looking at the overall number, I guess, if we're not gonna be able, I don't get the sense that there's the will or even there's the time to go through object code by object code. That ship has sailed. We do not have the time for that. So,
Well, and I think Dave is really clearly said he has been doing that work. If you want to share with them the level of really scrutinizing you've done too, on
Well-
this budget, like line by line, over and over and over again.
there's no need to belabor the
I don't
point.
even know if I need to go there, but I'm in
Yeah.
it every day, trying to look at
Yeah.
every single
Mhm.
line
Yeah.
item
Yeah.
times 2.
Yeah.
I guess I would say just for right now, like over the next couple days, if we could get, a what if scenario, not saying it's an option that I would advocate for, but I just would like to know what it would look like as far as like trying to get the number down to like a 7.5% or a 6.5%. Just to see, again, array of options, get a range of like cost benefit analysis,
What would that look like?
right,
We
just,
have to give up,
To get what we get.
but I don't
Right.
want to give up any more tutors or teachers or
Right.
paras.
yeah. So I mean, again, like looking at like professional services, and that may be where we have to look critically at the consultants that we do know about, and seeing how, like other areas that, are not directly impacting students. I know some consultants do work directly with students, but maybe others do not. So it would just be nice to have that array so that, again, we're here representing the community interest.
Yeah.
That's what we're elected to do. So I think, in the matter of due diligence, we need to, just kind of keep playing that what if game. Okay, what if it is a monumental effort, and I thank everybody involved for getting us away from the 13.54 increase and getting us down to, the realm of the rational and back to where the original number was. So that's a tremendous amount of effort, but like I would just get a look at like what if we wanted to go just another % or 2 down.
Yeah, what would that look like? And I don't want anything personally. I don't want anything that's going to affect the students directly. And I have to say, I don't really want, academics are very important. I think sports are also important. I don't want to see things that are going to affect activities that really give our students a well-rounded school experience. And so we have to find, even if we're just looking at the consultants that are in the general
I don't
budget
think
right
we
now,
have many in the general budget, but we'll look.
but
We'll look.
something,
Yeah.
and let's all sort of decide that this is the last year that a budget will be done this way, and it'll be done with a much more studied eye.
I think
Precision.
we need to thank and recognize what Dave is doing, walking into this
Yes.
quagmire.
Yes, yes,
And,
yes.
Please
God,
do
you had a
it,
full head of hair.
We do
Sweet
appreciate
today.
you, Dave.
Dave, yeah, honest to goodness.
And
He's done
Karen
what no
is
one
right.
else could have done. I'm just telling you that.
To that end, I would add to the
Express my personal
challenge.
thanks.
I would add to the challenge too, to see as we adjust those numbers for the what if scenarios, can we get the number for the software upgrade, and can we put the financial temp help back in there so that we can get transferred over to software that's far more agreeable to work with, to your end as far as
And a document management system.
right. Like
Made for
I think
boards
that's
of ed.
that's a worthwhile investment because I think
We
it'll
can recover the cost when we sell it to other boards.
produce dividends in the long run.
Enterprise.
for
Maybe
future
Clint
savings.
can program it in his spare time.
Yeah, I was just gonna say, I think that investment, if we look at it as an investment, it would produce dividends in future savings, with that kind of transparency and access. Thank you.
So
Adrian, I think, and then
Yeah, so I do want to just voice that I feel we're cutting a little deeper than I feel comfortable with cutting tutors, cutting as many tutors as we have. Because it is a different district in a different, well, maybe not a different district, but we have different needs than we did 5 years ago. And I think that we need to sell that, however you want to word that, to the community, that we have real needs. And if we cut all of them, or even as many as we have, and I'm gonna ask Denise to go back to say, you know, what are we losing when we lose 43 special ed tutors? Because these are people that are providing real services for a real need. And how much is that going to affect our special ed department, like the kids that are in special ed? I mean, to me, these numbers, I mean, we're losing almost 10% of our workforce. I mean, this is a huge cut in, you know, in employees. And I mean, it seems to me like a vast majority of it is with the direct instruction, you know, the people providing, you know, direct instruction to the kids. So I guess I'll just leave it with that statement that I personally don't feel that we should be cutting as deep on, you know, the hourly and the lower wage workforce that we have. But I'll leave it with that, and then just please explain to me what we're losing when we lose those 43, you know, tutors.
Sure. Our intention is to transition back to the plan that we've utilized in prior years, which is to utilize paraprofessionals to provide those services. So it wouldn't be that the students would be losing a support staff. It would just be the role of that support staff would be slightly different.
All right.
In
So
terms of
We've accounted for those
paraprofessionals.
paraprofessionals in the budget.
Yeah, the
So we have the number
paraprofessionals-
of pairs that we need.
all right,
absolutely.
so I guess I would just say, how many paras? I mean, I've looked at the website occasionally, and it seems like there's lots of openings. Why aren't paras working here?
Well, I mean, previously, we had some competitive wage issues, which, you know, we did work through the contract, which took quite some time, but we have made improvements in that area. That was a big driver for sure, is competitive wages previously.
And it seems like paras are still making, starting wages is very close to minimum wage, if it's not. I mean, I think this year it's minimum wage, and next year it's just a little bit above. Are we competitive now?
With the contract we negotiated, the entry wage is now competitive with the local school districts in the area. We did competitive wage studies. We compared that. We spent a lot of time with the paraeducators, being sure that we elevated the hiring wage to a level that we felt like we could start to attract individuals from a competitive wage standpoint in the region. Experienced tutors received increases above that. So I think we could certainly share with you, and I think it's worthwhile to share what the contract and the wage schedule looks like over the next 4 years, because there is considerable movement in each of the years. Yeah. I think that will have an impact in our ability to find paraprofessionals or paraeducators, I should say. Are we going to find them all? I don't know. I mean, we're
We
in a
might have
national
to have some of
workforce
those tutors
shortage.
if we don't, you know. we
Yeah,
might have
so-
to keep
There's a
some of them.
statewide
Yeah.
shortage for
I would
paraprofessionals.
rather plan for what we expect in reality versus what we'd like in an ideal world. And if we're gonna have a hard time finding 50 more paras or 60 more paras, which it seems like that might be somewhere in that realm, do we need to cut less tutors and, you know, and go about it that way? So.
Yeah, I would also like, I share that concern as far as like the tutors go. Sorry, I wasn't looking up. Did
No,
I
that's okay.
speak out of turn? I'm sorry.
No, that's fine.
I do share that concern, and you know, I would be curious to know like what the difference is between, you know, the certifications that a sped tutor brings to the table versus a paraprofessional. And
Yeah, neither role is certified. They're non-certified staff.
okay, so I thought all tutors had bachelor's degrees.
They do. I was referencing your question about what certifications they bring to the table.
Okay, so they're required just to have a bachelor's, so what qualifies somebody as a sped tutor?
They have to have a minimum as a bachelor's degree,
Any subject?
any subject. Mhm.
So there's no
That's for all of our tutors, right?
Mhm.
distinct, sped training.
We certainly
Specific.
consider that, but it's not a requirement.
So
Jen?
I just want to state that as a board, we have a fiduciary responsibility to the student body, right? The
Mhm,
teachers and the town.
mhm.
If we can't afford it, we can't afford it, right? And as much as we want to be able to support everything, sometimes we need to make hard choices. To quantify what Ian was asking earlier about the scenario analysis, I would like to throw in, like, I would like a 4% scenario, a 6% scenario, and we already have the 8 in place. And the implications of going down to 4%. All of the ARP ESSER employees who were hired, right? They know that they were under a grant and they know that their position is in jeopardy. So it's not like we're breaking any trust there at this point. The minute we add them to our budget, if we add them this year, and then we're going to release them, let's say the following year, because we can't afford it, I feel like that's even more of a disservice to those individuals. So if we're going to have to cut, let's do it this year, because at least it's our ESSER and we didn't put them in our budget just to take them out. It's things that we need to consider.
I like the idea of having the 4 and 6 and 8%, because even if we go with the 8 or 9, 8.5%, we're able to present to the bodies that we've taken the time to look at these other variables. And this is what we have decided would have to go. And you have to decide whether you trust us with what we've submitted to you. One other thing, changing topic. There are no easy or good choices here. There are just less bad choices. But there are 2 opportunities for us here too. The first is this conversation has focused the town council on the fact that it has been numerous years since council has put a lapsing fund on their work list and have not dealt with this. This is a great opportunity to say, you see that you're sharing our pain with us. Now help us share a solution. Please schedule discussion of the lapsing fund by whatever title. Put it on your agenda. The second is OPEB. Tell them that we have done, we're gonna cut 1.6 million, was it? By the skin of our teeth. It ain't there next year. Understand that. Make that very clear now while they're focused on the problems, so that they know that's not a pot that's subject to rating again.
So if you start that, the new, looking at the upcoming budget, as soon as we finish this, how much do you, not, maybe that's not the right way to ask it, but will there be a significant savings as you're thinking about what you're gonna do?
Well, I mean, we could theoretically uncover things, right, during that process that would even be usable in the current year.
Oh.
I mean, we could uncover efficiencies, right, through a deep dive and analysis that we didn't have time for now.
This isn't a deep dive.
Well, it is, but let's face it, I mean, there's more to look at. I'm not saying that there are more efficiencies hiding somewhere, but we owe it to really.
I agree, that's why I'm asking.
Yeah.
Just to make sure.
And to Dave and Ian's point, that software would give us the view we need.
I just want software that talks with your 2 departments. It takes enormous energy to make sure that we've got all the people in the right places. They do an outstanding job, but I would love to be able to figure out something there. could actually work together, you know, easier. For you. But I guess we have to see what's out there.
And again, I would encourage like range of options, right? Give us like, whatever you find, 3, 5 different, pathways that, and especially I know that you worked with a different school district prior to this that had something that you're familiar with, so I definitely would be curious to see that because that could also ease the transition. Yeah.
At some point, thinking about our wages for paras, at some point, we may be competitive with other school districts. I accept what you're saying. But I bought some groceries today at Stop and Shop. They're advertising by every cashier, work for us, $15.69 an hour to start with health benefits. That's the competition we're facing.
And we know how much those cost.
Yeah,
We know how much it costs, and
Well,
Ahold,
we don't know what their plan is.
Ahold is a for-profit organization that for them it's a cost of business,
Right.
but they're able to recruit.
I'm afraid to say.
Oh, no.
Oh, no, no, okay. Well,
I
then,
got a question.
oh, yeah, I just wanted to say that I asked that question because I know that there are, that before I ever came on the board, I had no idea. So that's why I'm asking a question like I did about if you start within the next few weeks, will that really make a difference? Because I know there are people out there who have, who are probably thinking, well, why didn't they do it before? And what's the big deal?
But we'll find out.
I guess we
We
will.
will only know by doing it.
Well, no, I'm not suggesting that we don't.
So, are we like, can we just kind of recap like what we can expect to do tomorrow night, what we should expect to see, what we're going to discuss?
We sent out an agenda.
Yep, so the first thing we're going to discuss tomorrow night is the town's annual audit. And then we're going to go into a budget work session, and will you be able to bring in
Some what ifs and some different percentages. Yep.
our scenarios?
Right.
And I think we just brainstorm those, and, I don't think anybody's going to vote for one list, but we can sort of move things around until we come to something that makes sense.
Right.
Keeping in mind that Dave is going to have to take whatever we come up with and plug it into a budget document and get it, to the town manager by February 28th, so.
Yeah.
Well, I was talking to the mayor, and through the mayor, it was understood that it could be electronic.
Manager, you mean? Or mayor?
Yeah, the mayor, through the manager. I guess she must have asked the manager.
Okay.
I always thought it was a physical book.
I'll double check that.
Okay.
To Adrian's point though, as these scenarios are, can we look at scenarios that are maybe more realistic, or different combinations of, the sped tutor situation, right? Like, are we really going to be able to replace all of them with paraprofessionals, or should we prepare ourselves for a different ratio of sped tutors to paraprofessionals? I would just say, like, let's try to be honest with ourselves, about that possibility. And
Like
also,
the sub and the daily sub, the regular sub and the daily sub.
Yeah.
right.
3,600 work days. That's a lot of, there's going to be a lot of subs filling in.
But
for
we
those
don't,
days.
usually the daily subs aren't, the permanent building subs do come every day, but daily subs come only when you need them.
Yeah, no, I'm not saying,
Yeah.
I'm saying there's 3,600 days. There
Right.
might be 1,000 days, 2,000 days, or 3,000. I don't know. I mean, I'm sure you guys can figure it out based on history.
Yeah.
Yeah.
Do we have easy access to the number of per diem subs in the last year? Is that easy to disaggregate? Well, if it doesn't turn your hair white, it's something to do.
do we contract with one of the substitute services as far as like a dispatch that sends substitutes out?
We do not. We do all of our own.
It's all in-house?
Yeah.
Okay.
Yeah.
The per diem subs, not the billing subs.
Both.
Both
Yep.
are all in-house.
It's all in-house. yeah.
Okay,
To work with an agency, we'd pay a premium. So we do all the work in-house.
understood.
And I have to say that doing it in-house is much more efficient than doing it through the agency, having done it both ways. Do you know, Susan, I'm sorry, I shouldn't be yapping.
Go ahead.
Do you know, Susan, what percentage of the building subs are in use every day? Not putting them with this child because he could use some, or she could use some extra help here, but
I know
actually.
that our attendance has really struggled, children and staff with COVID. It's been enormous. It's been more than we've ever seen in our lifetime. And it continues. I mean, I've said this before that everybody is not all the way well. We have had all kinds of illness this year. And so when you do have several staff members out and in a school like Mystic River where there's paras and teachers, and they've got the largest number of paraprofessionals, that it requires a lot of hands on deck. And so our principals are really trying to manage that. And I would say that we really are utilizing our building subs to capacity most days. So, you know, I mean, there are some subs that are also paraprofessional subs that we sometimes have on standby too for the para, and they're not paid exactly what the teacher subs are, but and then there's some subs that are daily subs that are like aligned to the building so that they, you know, will go to the Mystic River because that's their school. And so they're easy to contact and easy to get in. So we have them in different ways.
Oh, that's what we had.
But we're still utilizing, I hope for the day when people aren't experiencing the illness and, you know, what they've been dealing with.
Thank you.
One thing I'd like to mention is, so we have a tentative Zoom meeting scheduled for Friday, and unless there's any objection, I'd like to move that start time to 7. It may very well be that we don't need the meeting at all, but this room will not be available due to this equipment going to the high school for the play. So I just would like to propose that we start that night at 7 if we need it. So we're going to post it, but it may end up being canceled. We will make that decision, you know, tomorrow night. Okay. Based on the outcome of that meeting.
I'm fine with the 7 o'clock start for Friday, tentatively speaking.
Do we come in our pajamas?
It's
Are
in
you
Zoom.
saying
You can be
Zoom
home.
only?
It's Zoom only, yeah.
Oh.
There'll be nobody.
For people on this side of the.
I didn't want Dr. Ackerman showing up there.
I would
The
have.
building will be locked, so I assume. All right.
All right,
Thank you all very much.
Andrea,
Are there any
you're up.
other?
you're up.
Well, I don't want to overstep my bounds here. Motion to adjourn.
Second.
All in favor?
Aye.
Opposed? Abstentions? Thank you, everybody.